Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with the exciting edition of Technique Tuesday. Today we're going to film a series of exercises for neck pain. I've already done a series of progression, and this is for people who are not responding to those exercises. Either they did nothing for you, or maybe they potentially made you feel a little worse temporarily. So this is going to be for those people. So neck pain, that can manifest in the neck, right? Up in here, the upper trapezius region. It can go into the side of the shoulder and even all the way down the arm. If you're having any symptoms like that, it could be coming from your neck or around the shoulder blade, okay? So pain residing in the neck, here in the upper trapezius region or shawl region or down the arm potentially, or the shoulder blade. Any or all of those are fair game. All right, so the ones I did on a previous video were, I'm going to show you here from the side. One was called Cervical Retraction, where you imagine the pie coming in at your face or a person you don't really want to kiss you, trying to kiss you. So that's Cervical Retraction. Or the progression of that would be Cervical Retraction and then Extension. So if either one of those was working for you, no need to do this one, okay? If it ain't broken, don't fix it. However, if they weren't working or it was maybe temporarily making you feel a little worse, then let's try this progression for you, okay? This one is called Cervical Retraction with Side Bending, okay? I always encourage you to do your neck exercises, if you're doing them in a seated position, to do it with a supported back. I wouldn't do them in standing. And I even like to put myself with the lumbar roll because it just puts me in a better posture. It gets my shoulders, low back, mid back, kind of in an ideal position. All right, so here's the technique. So what we're going to do for this video is pretend I didn't just write on my hand. I'm going to throw the pen over there. But we're going to say that I have right-sided neck pain. Okay, say it's right-sided pain going into the shoulder. What you do is you do a little retraction. You're going not the big one that we've done in the exercise, just a little retraction. Pain's on the right, so with my right hand, I reach, nope, sorry, that's the progression. So I'm just gonna do this one first. This is level 1, okay? Less force. Little retraction, and then I bend my head toward the side of pain, hold for about 2 seconds, and then back. Bend the head toward the side of pain or symptoms, and then back. Bend the head toward the side of pain, and then back. And look, I'm holding the retraction the whole time. I'm not bending and then coming out like this. I'm keeping that slight retraction, okay? It's going to put the joints in a better position to have a stronger effect for the technique. This is one of those techniques where end range is important. End range meaning you're trying to get as far as you can into that motion. End range is where the magic happens. So if you're only doing this, you're probably not going to have a strong effect. That being said, if it is painful, just kind of move into the pain slightly and back, and it should start to feel better as you do more if this is the appropriate technique for you. Sometimes what you find happen is the symptoms that are distal, so the symptoms that are farthest from the neck, they might start clearing up a little bit, but you might start getting more pain in the neck. That's actually a good sign if that happens, okay? If you do the exercise though and you feel like your symptoms are starting to go farther down the limb, might not be a good exercise for you. Okay, so we want to bring the symptoms from the limb or the shoulder blade region back up into the neck or upper trap region. If that's happening, this is a good exercise for you, okay? So once again, little retraction, bend the head over as far as you can, hold 1, 2, and then back. Bend the head toward the side of pain, and then back. You're gonna do 10 to 15 reps every 2 to 3 hours. 10 to 15 reps every 2 to 3 hours. Monitor your symptoms, see how you feel afterward, see if your motion feels better. Check the things that felt limited. If your motion's a little better and you're feeling better and the symptoms are kind of moving out of the limb or it's starting to feel better in the neck, this is likely a good exercise for you. If your symptoms feel worse and they're moving down the arm or down the back farther, might not be a good exercise for you. Check with your physical therapist or physician before doing this exercise to make sure that it is appropriate for you, because it's not for everyone. I'm Dr. Sam Schroetke here with Physical Therapy Hand Clinic of Hillsboro. Please like us on Facebook or follow us. Follow us on this YouTube channel. Leave comments below asking questions. about potential exercises, techniques, or complaints you might have. All right, thank you.